Mhm.
Well, you know, Adam, we filmed you earlier, and you were told that you just had PTSD. Is that right?
Yes.
Post-traumatic stress disorder, and that any of your complaints could just be written off as post-traumatic stress disorder. And I know when we did a little test of your balance and found that you had very severe balance problems. And if I recall, on one of the events that you experienced, you remember, it took you the 2 days to remember to tell me that you were bleeding out of your left eye and your left ear after
Yes.
one of these events. And we were able to demonstrate that you had, your balance was all shifted to one side. And after that event that happened, back during the time that happened, you reported to me having difficulty talking.
Right.
And also, you had been unconscious for some period of time. Was it a half a day?
Yes.
And then you had to learn to walk again. Is that?
Yes.
And in learning to walk again, what did you feel at that time? Why did you have to learn to walk again? Did you have weakness in your legs, or?
It was mostly the vertigo, the dizziness, bright lights, anxiety. A lot of that stuff would cause the spinning of the room. I'd see the world not as everyone else saw it. I saw it at an angle. So I had to learn to overcome that and started to adjusting. I had the difficulties, almost impossible to walk at night when the lights are out without running into things or falling over. Since I did have the concussion on the left side, I always had a tendency to fall over to the left side.
So, and of course, when we tested you, that's what is known in the world of neurosciences as a Bromberg sign. And if you were standing and you closed your eyes, you would lose your balance, right?
Yes.
And now, the first thing was that we were able to identify for you that you didn't have a PTSD problem, that you actually had vestibular and cerebellar problems, that we were able to show you that your weight was all off to the right side, and that when you tried to show us where midline was, in other words, if you were trying to put your weight evenly on both feet, you were surprised to find that you were still off. You weren't on midline. Remember that?
Right. Yes.
And that if you tried to shift your weight to the left, you couldn't get there.
Mm-hmm.
And also, we put you in a vestibular chair, a chair that rotates, and we spun you 5 times one way. And what was how did that make you feel when we did that?
It made me feel nauseated. The whole room was spinning, and it took forever to recover off of 5 spins.
And what are you experiencing now? How many spins are you at?
Today I'll do 20 spins, and I'll spin and I'll stand right up out of the chair after maybe 1 second. So
no more vertigo?
The vertigo's almost gone. Maybe a couple more spins, I think I'll be 100%.
Yeah, no more nausea?
No more nausea.
So, you know, this is obviously to just about anyone that would look at the early film that we did of you and realize that here we are, you know, in a period of a month, able to go back and get this vestibular system working for you. That's a neurologic thing, and hyperbaric oxygen is not going to fix that.
Right.
That's to be clear, hyperbaric oxygen is a wonderful thing, and there are many doctors and other providers who have recognized the fact that hyperbarics does seem to have a pretty big impact on neurologic problems. But so the combination of the rehabilitation, the coordination activities that we've had you do and all that has kind of gotten you to where you just don't. How does the world seem to you now? Are you at a slant, or do you feel like you're kind of back to normal? Or
No, I feel like I'm back to normal.
Yeah.
Feeling really good. My balance is on. So
sleeping better?
Oh, absolutely. I mean, sleeping. We're getting that deep REM sleep that we've never gotten in the past. So the quality of sleep is so much better.